Hello everyone, today I'm going to discuss Dr. Buget's case and I'm going to help him and Isabel to choose the blinding method for their case. Dr. Buget's main challenge is to choose the blind method and he wants to choose the method that gives the study high quality and unbiased results, but that can be also feasible and cost effective. Dr. Buget is really concerned with the adverse effect of the treatment that he is studying. So he is wondering that maybe because both of the participants and doctors are blinded to the treatment, there will be unreported side effects that could affect patient safetyness. So they are trying to find a blind design that balances scientific quality with practicality. And they consider to go for single blinding method or single blind study with an external blind iterator. And these methods are good for monitoring the side effect, but they can also increase the risk of bias, which can lead to the low internal validity of the study, especially because the endpoints are soft endpoints which are subjective and self-reported, so definitely can be influenced by the doctors. I believe if blinding is not done properly, the results can be biased, and even if the study concluded that the treatment is good for the patients, there will always be a question whether the results are good or not because of the internal validity and the risk of bias within the study. Definitely we have to go for blinding in order to keep the internal validity of the study, and I recommend the double blinding method because it's easier than a triple blinded method and is cost effective and it's simple and elegant, so this will be my final decision. However, we have to keep participants safe as well, and I recommend to implement an independent data safety monitoring committee, and this committee can be unblinded to the study participants and their treatment. They can monitorize the study, and if necessary they can stop the trial early to protect the patient. Even though having this committee may increase our cost, I think with good planning is doable and we can avoid making trade-offs that could weaken the results. And with this method we can have the scientifically strong paper but still keep the patients safe. So this will be my final decision, a double blinded method with a committee who can monitorize for adverse effects. Thank you.